Perineal massage is used towards the third trimester of pregnancy to help prepare the perineal tissues and the pelvic floor muscles to lengthen for labor and delivery. During childbirth, the pelvic floor muscles need to lengthen 3 to 4 times their natural resting length to help with the baby passing through the vaginal canal. So perineal massage helps to stretch and prepare those tissues for childbirth and for that lengthening. To do this, the best way is typically to have a partner help you, but it can be done individually as well. So if you're lying on your back, you can kind of imagine that this is your pelvis. So if you're lying on your back, the vaginal area would be here, and your pubic bone is here, and the tailbone at the back. So when you're lying on your back, you can be a little bit reclined to make you more comfortable, and what your partner will do is use their thumb and they'll gently insert into the vaginal opening just about to the first knuckle of the thumb. And then what they're going to do is just start to apply gentle pressure downward into the vaginal canal and into the perineal tissues. You might feel a slight burning at first, though as they hold, that burning should subside. So they're going to hold there 30 seconds, 60 seconds at most, and then they can move and go to each side, so kind of towards like 3 or 9 o'clock with their thumb inserted, pushing out towards the side in both directions. And then what you can do is actually start to make sweeping motions. So you can start with the thumb there at the bottom at 6 o'clock, and then you can sweep over towards 3 o'clock and sweep over towards 9 o'clock. And you can work on giving some pressure and stretching throughout that perineal tissue. Again, you might feel a little bit of burning with this, but that should subside as you continue with that perineal massage. All this takes is about 5 minutes. You can do it daily, but even doing it 3 to 4 times a week, starting at 34 weeks of pregnancy, can be really helpful to reduce perineal tearing and help with that preparation for birth. Now you could also use something like a pelvic wand. This is from Intimate Rose. It's a silicone based tool, and you can use either end here, but this tip end is really nice, and that can be inserted into the vagina similar to the thumb. And then you're going to use that with your hand on the handle, pulling down, same thing, going at 6, 3, and 9 o'clock, or doing gentle sweeping like motions. So this can be done a little bit more individually, whether you are lying on your back and reaching around, or some women like to place their foot up on the tub or on a stool and while you're standing, and you can use the wand in that way. So again, 5 to 10 minutes, 3 to 4 times a week, starting at 34 weeks of pregnancy. And this can be really helpful for reducing the risk of perineal tearing. You might follow that up, or during perineal massage, do some really nice gentle diaphragmatic breathing to help these pelvic floor muscles relax even more and get more of that lengthening and preparation for birth.